Hello, my name is Jasmine Johnson and I will be administering a tube feeding. The first thing I would do would be to verify the medical orders. I would check the type of formula and the concentration. I would check the volume, route, rate, and frequency, and then I would gather my equipment. With the equipment, I would check the expiration date of the formula. Next, I would perform hand hygiene. Then I would identify my patient and then assemble my equipment and perform an abdominal assessment. Then I would position the patient with the head of the bed at least 30 degrees, and I would put on my gloves. Then I would check or verify the tube placement. To do that, I would check the position of the marking on the tube. I would measure the length of the exposed tube and compare it with the documented length. And then I would check the pH. To do that, I would flush with 30 milliliters of air and then aspirate a small amount of the stomach contents. I would also check the color and the consistency of the residual. Then I would check the pH level. Then I will aspirate all the gastric contents and measure the amount, and then I would either return the contents based on the facility policy. With intermittent feedings, I would check the residual prior to each feeding, and with continuous feedings, I would check at least every 8 hours or per agency protocol. Next, I would flush the tube with 30 milliliters of sterile water, and then I would remove my gloves and perform hand hygiene. Next, I would put on new gloves, and then I would administer the feeding. There's two types of feeding systems. The first is an open feeding system. With that, I would label the bag and the tubings. I'll perform my demographics. I'll check the formula type, the administration method, the time and date prepared, and time and date hung. I'll also put a warning sign that this is for enteral feedings only and not through an IV. Next, I would hang the bag on the IV pole 12 inches above the stomach, and I would clamp the tubing. Then I would prepare for feeding setup. To do that, I would check the expiration date of the formula. I would cleanse the top of the feeding container prior to opening, and I would pour into the feeding bag. Then I would prime the tubing and then clamp the tubing. Next, I would attach the feeding setup to the feeding tube. I would connect it to the feeding pump. I'd set the prescribed rate, and then I would unclamp the tube. Then I would flush with 30 milliliters of sterile water. I would check that the feeding bag or the feeding tube, I would check the feeding tube and rinse out the feeding bag and the tubing, and then I would clamp the tubing. Then I would disconnect the feeding setup from the feeding tube. I'd maintain my patient in an upright position for at least 1 hour after the feeding. With the closed system, I would check the expiration date. I would label the bags and the tubing. I'd spike container with the compatible tubing. I'd prime the tubing, I'd connect the tubing to the feeding tube, and then I would connect the tubing to the feeding pump, and then I would set the prescribed rate. Then I would disconnect the feeding setup from the feeding tube and flush the feeding tube with 30 milliliters of sterile water. Then I'm done, and then I would document.